right, everybody, this is Micah Lieberman once again coming at you live with a Voices of Scope interview. This one is different. I have two guests, and the story's unique. This is a story that kind of came about, born of Scope, but also born out of two interesting companies that have a story to share, and a bigger kind of pain point in industry and with sites to solve. So I'm going to introduce my two guests and two different companies solving different problems that kind of built an alliance, and they're kind of partnering to tackle the increasing complexity in global trials, all these systems that aren't working. So this is a bigger story. Some of the points we're not going to tackle because we talk about them all the time at Scope. But this relationship, the way it came about, the two cultures coming together, that's a story in and of itself. So Mario Papillon is the CEO at Perceptive, and sometimes you'll see Perceptive as listed as Perceptive eClinical. I just call you guys Perceptive. Hello, Mario. Thanks for being here, man.
My pleasure, Mika.
All right. And then I have Guillaume Juge. He's also a CEO and president of Kayentis, and he's coming at, you're in the UK, Mario, and you're in France, Guillaume, right?
That's
all
correct.
right. All right,
That's right.
good. Afternoon your time. Guillaume, thanks for being here.
Thanks very much to you.
All right, so let's start. You guys could take it where you will. You might want to talk about, like, I'll hand it over first of, like, how did this happen? And then talk a little bit about the journey.
Okay. Maybe I can start. So obviously, Perceptive has been into 30 years journey, and in our evolution, we decided to really invest into best of breed applications. So we build obviously a new RTSM, but we also know that if you look at the market, the client's need and the pain point, they want to work with one vendor offering different solution. The sites wants to use one tool, one login in order to access different systems, right? And we were looking really, and we believe in best of breed. So what is the best, application for our RT? What's the best ECOA and so on? And Kayentis was definitely at the top of our list. We also look at the culture, a culture that is focused on site satisfaction, customer satisfaction. And if you look and log in onto the Kayentis website, you will see that that's at the forefront of their website, and it is also on us. And so we were looking at where we can meet, and obviously Scope was the ideal dating place. And we knew that Guillaume was there with Mathieu, his CFO, and then we arranged a meeting with them, and I think it was love at the first sight.
Yeah.
We realized very quickly that we have the same vision of the business, we have the same understanding of our clients, and for us it's really important. And then I'll let Guillaume explain why it took the time it took, but I think it's important to do things properly.
Yeah, so that was Scope. So Guillaume, earlier you said it was at Scope 2025 where this got started. And we're already now obviously in 2026. So it's been, and Scope US 2026 just happened a few months ago. So it's been a while. So yeah, Guillaume, what's your perspective?
Well, first of all, yes, I have to highlight, I mean, I totally agree with Mario mentioned about well, first of all, I have to say that we are far younger than Perceptive, as you can see, but we're 20 years, not 30, but still, we've been in the industry for a while. And we've been constantly hearing feedback from sites and from sponsors about the increasing complexity for sites, which is really has become a nightmare, sometimes up to 15, 16, 17 systems they have to manage in a given study. And we feel that we need to play a role on how we simplify their life. And we had been integrating with a series of IRT systems in the past on a rather light approach. And even before we met with Mario, we felt that there was something bigger to do, deeper integration in terms of product, in terms of services, for two things. I strongly believe, like Mario does, that a one-stop shop's fine, but it's fine if it's the best of breed. A one-stop shop with poorer systems or poorer modules does not bring the value they need to do because of the quality which is expected in pharma, which is the highest possible. So we had that meeting in early 25 with Mario and Mehdi at Scope. So we spent some time, but obviously not enough. So we had a series of meetings afterwards to define what's the value we can bring to sites, what's the efficiency we can bring to sponsors. And honestly, it took some time. We absolutely wanted to be fully aligned, to absolutely define, integrate on a product standpoint, on a service standpoint, to see where are the efficiencies we can bring for the sponsors and for the sites. And it took months because it does take some time to build quality. And now we are there. So we launched the announcement just a few weeks back because I think we have something really great to bring to market at this stage.
Yeah, I saw it on the wire. It was really good. All the language is there. All of the pain points that our people at Scope are iterating, that saying over and over. A lot of my Voices of Scope interviews are addressing exactly these pain points. And Guillaume, you said two things. You said for our pharma and biotech customers that are trying to streamline, gain efficiencies. For the sites, you want to reduce burden, overall reduce complexity, right? It's hard. It is hard, you know. When you guys were doing this, like, did you have a lot of sites that you have relationships with? So once you get together, you're like, hey, we want to do this. We want to build an alliance. We want to build a best-in-class new tool, which is not its own thing, which is based on this alliance where we're known as more the IRT company. We're more known as the ECOA company. How'd you do that? Did you also bring in a bunch of your sites and a bunch of your customers and have them with your developers and literally workshop this? You knew where you wanted to go. I just want to get inside, under the hood. I've worked with developers. I've built stuff before as well. I'm just curious, how did you do that when you said, we're going to do this? Here's what we think it's going to look like. And you have two separate offices, two separate groups of people. You have your own developers. How did you do that?
You want to go first?
Yeah, so we did create advisory board with customers and share the vision, because at the beginning it was a vision, right?
Right.
So this is where we are today. This is where we want to go, and what are your pain points, and how would you embark into this, and the fact that the customers were saying, look, it needs to be simple, but it needs to be efficient. We don't want to sacrifice quality for speed. So this is going back to the best of breed, and having this feedback, it is very important. The process, the whole process, like the obviously the procurement process, the study setup process, the project management process, and then the closeout and so on. So it was easy with Kayentis because when we sit down, we look at the commercial, we look at operations, we look at technical, and there is a full alignment. And when you say it's two teams, honestly, when we are together, it's one team.
There you go.
You can just feel the integration, the natural integration.
And that goes back to what Guillaume was saying about cultures. The cultures matched, and that's important, right? This is a people business. Yeah.
Yeah, absolutely. And if I can comment on this and just give a compliment, this is a specific industry where the sponsors will buy our solutions, but the users are mostly the sites, and for us, the patients for ECOA. Right. So if you fail to capture their needs, their feedback, you just fail something. I mean, obviously everyone can have an idea on what they would expect, but if you don't ask them, you don't know. So we constantly, that's why we have a medical direction, and we work alongside with site associations, representatives of patients, so that we have their voice back and ask them, is that what you want? Isn't that the extra feature which looks nice on a technical standpoint, but not usable on a practical standpoint? And that's really key. So that's what we constantly do, obviously.
Yeah. All right. This is great. I'm really glad this story happened. And I did make the tasteless joke that it's like one of those terrible American or European dating shows where you put all the bachelors and bachelorettes on an island, right? And somebody has to get married. But this has less drama, more interesting, more positive outcomes, and ideally like making changes for this industry to like bring medicines through development smoothly, right? Streamline it, make it less burdensome on sites and patients. Cool, man. Great story. Mario, Guillaume, thanks for sharing it. I'm really glad that Scope had a tiny role in that and being that island on the dating show, but I think you guys both deserve a lot of credit for making the jump, right? So congratulations on the story and the efforts.
Thanks, Michael.
Thank you.
Okay. Bye, Mario. Bye, Guillaume.
Fine, take care.